Hello, everyone. I'm very pleased to be here with our Henry County Health Center CEO, Robb Gardner, Chief Executive Officer. We talk to Henry County Health Center on a regular basis to find out what's going on. We talk to different departments. We are educating people. We are informing people. And this particular episode is very important in that regard, Robb. We want to talk about status of the Henry County Health Center. What's happening? We're hearing a lot in the news about healthcare. We happen to have in our county a critical access hospital, and it's been there for a long time, and we depend on it for a lot. So sometimes it's all about the bad news, but let's talk a little bit first about the health center's performance over the past fiscal year, because I think there is some good news in there about the work that Henry County Health Center has been doing.
Yeah, thank you, Theresa. Thanks for the opportunity to come out and talk this morning and talk a little bit about what's happening at the health center and kind of a brief little state of how the health center is doing. And, you know, we continue to do amazing things every single day. We have great men and women who are so committed and compassionate to provide outstanding care. Our medical staff, our associates, our leadership team, and our board of trustees. And so, you know, we always look at things kind of as a summary. We look at it based on fiscal years, just because that's how when we do our planning, our strategic planning, our dashboards to set targets, we base that, and that based on a June 30th end. So when I talk about fiscal year, it's based on June 30th of 2019. But as we looked at last fiscal year, there were some really wonderful things that we were able to accomplish that really hit our strategic objectives. And you know, some of the most notable things is that the health center was again recognized as a top 100 hospital in the nation for our performance in the quality metrics, patient satisfaction, our cost, our charges, along with how we benchmark in comparison to the other 1,250 critical access hospitals throughout the nation. And so that's the second time we've been recognized. The other time was in 2016, so pretty recent, just 3 years apart. Also, too, the health center was recognized again by the Health Finance Management Association, a national association of finance leaders, as a MAP award winner, which is an award that looks at an organization that has high-performing revenue cycles, but also, too, has high-performing patient satisfaction process improvement. And the health center was has still be the only critical access hospitals that's been recognized multiple times. And, you know, our peers that are also too recognized with that recognition are Geisinger, you know, Kaiser, some of these large academic medical facilities, urban facilities. So we're right there with it. So we have some really wonderful processes. So along with that wonderful national recognition, we did hit some local strategic objectives. For example, we saw growth in revenue, which we had hoped for. You know, about 6.3% growth in revenue, which that's removing the price increase. So that was really good. At the same time we saw that growth, we only had expenses grow about 2%. So that's a good difference. We actually had a 3.5% increase in overall number of procedures that we performed at the health center from year to year. And so that was actually our goal, is to have a 3.5%. We're a 4-star hospital under the hospital compare. So just to kind of help everybody understand that, it's a 1 through 5. So 1 star is the lowest rating. A 5-star hospital is the highest rating. Henry County Health Center is a 4-star. And there's 5,000 hospitals approximately throughout the nation. And the top 28% are 4-star or above. So really, you know, we're doing really well with that. You know, some other things that we hit some great targets on is our 30-day readmission rate from the health center. So that's a measure that says how well are we discharging people getting ready for stay at home and not have to come back to the health center. We're below our peer group, which is the critical access hospitals, the 25 beds or less in the state of Iowa, as well as the overall state average. So that's where we need to be. We had our lowest associate turnover rate in the last 3 years. So those are some great things. And then we had a lot of other key metrics that are strategic initiatives that we wanted to implement over the years. So overall, that was, really some high performing things that we were able to achieve.
And you have also gone to your folks and asked them for help with this. This is due to the work that everybody in every department is doing. You've asked them to come up with better ideas. This is where we want to get to. What can we do? You've asked them to cut their budgets. You've asked them to find efficiencies. And they've all risen to the occasion every single time.
Yeah,
and we're seeing the results
right.
of the associates' work in all these areas.
Yeah, and we have. Thank you, Theresa. They do every year. The board sets a strategic vision, and then what we call an operational plan. Every year, the strategic plan was released in 2017. It goes through 2020, and then we really set an operational plan every year, and then that gets deployed out to all the department leaders who then work with all their associates within their departments, and they set up metrics to support that operational plan. And, we look at our benchmarks in comparison to the state. We look at our cost, we look at our efficiencies, and we have good metrics that we actually show the board, we show the leaders and how we perform, and we perform well in those efficiency measures, along with the quality measures. The state of Iowa is blessed to have a lot of robust data about how we perform in terms of what throughout the nation, what Medicare, our country says, hey, these are high performing, these are important safety metrics, important quality metrics, and we perform well on that. And so, but that's a commitment to our organization, our leaders, our staff, and most importantly, our medical staff to really provide high level care.
A lot of success, but then, go to a board meeting and you hear the success, and then our friend Dave Muse stands up, and then we have to hear about challenges. And it sounds to me a lot of the challenges come in the area of finance.
Yep.
So given what you just shared, what is the hospital facing now that is definitely presenting a challenge for your organization?
Yeah, all those wonderful operational objectives, they didn't necessarily correlate to a positive financial performance on the income statement. So, within financial statements, you have, I would say, three important financial statements you look at. It is a cash flow statement, a balance sheet, and an income statement. And where the health center has been challenged over the last few years is on our income statement. And the income statement was challenged this past year. Our operating margin, even though I talked about where that performance was earlier and all the objectives we met in terms of strategic initiatives, national recognition, we end up with a negative 9.5% operating margin, which is almost a $3.5 million loss from operations. And so that's the largest we've had in my 10 years. And that almost doubled from the year before. We were negative 4.9. And the other significant thing is our total margin, which is after we receive our property tax support from our constituents in the county, along with investment performance. We were still at a negative 1.9%, which is a negative $700,000 bottom line. And so that's the first time we've had a negative bottom line on our income statement. And so, as you look at that, other things, we're seeing some changes because of that negative financial performance. And, and one might say, well, Rob, that doesn't make sense. You just talked about all these other things. So how can that possibly be? And one of the things that impacted us this past year is that almost approximately about 70% of our revenue was from governmental payer sources, either Medicare or Medicaid. And so both of those two insurance federal payers don't cover the cost to provide those services. And with that, especially Medicaid, when the transition to the privatization of the Medicaid MCOs in April of 2016, and I've talked about that openly over the last 3 years, that's dramatically impacted us. And so the last 3 to 4 months of our fiscal year that ended, our Medicaid revenue mix was almost 23%. So almost 23% of our revenue was coming from Medicaid care that we provided to Medicaid beneficiaries. And so that, even though we were providing the services, it was not paying for the cost of services. And then we have continued payment challenges, continuing ratcheting down of payment from the Wellmark Blue Cross Blue Shield of Iowa's. Obviously, our continued challenges with the Medicaid MCOs. And so as those situations presented, just like many throughout the state, so a lot of people have asked, are we alone? Rob, is this just Henry County Health Center? I've been asked that by associates and asked that by others, and unfortunately we're not. And so Iowa Hospital Association has been tracking finances for over 30 years of Iowa hospitals. And they just reported a few months ago, they just reported that this is the lowest operating margins that they've seen in the rural hospitals, which are 90 rural hospitals in the last 30 years. The operating margins are the lowest ever. And right now, the average operating margin for the rural hospitals of those 90 was a negative 2.8%. And so it's hard when you have a negative operating margin. It's hard to reinvest in your plant, replace equipment, do the capital upgrades when healthcare equipment's a little expensive. And so how do we replace that so we have the technology? At the same time, you're like, well, has that changed a lot over the years? It's interesting. There's 118 hospitals in Iowa. 43 of those 90 rural hospitals in 2004 had negative operating margins, and 18 that went up to 60. I just saw it for the critical access hospitals at the end of June. It was a negative 2.5, negative 2.8%. So ours happens to be a little higher because of our payer mix, the Medicare and Medicaid. Also, too, as a critical access hospital, we have service lines that are not cost-based reimbursed under Medicare. And so that draws down our payment overall for other services that are cost-based reimbursed under the critical access program. Some of those services that are not cost-based reimbursed, for example, are ambulance and labor and delivery, OB. So those are things that immediately impact our finances. And so, with those changes, we continue to advocate at the state level, the federal level, work with our state representatives, our state senators to hopefully make some inroads in terms of support. They have passed some legislation this past session. We haven't seen any impact of that yet because it's still hung up at the federal level. It's not the state, it's at the federal level for that support. And then continue to work at the federal level to see if there can be any changes. But obviously, I think we all know what's happening in Washington, D.C. right now. So we'll hopefully see if we can get anything accomplished there.
It's got to be frustrating.
Well, one of the things is that we do a great job every single day in caring for patients. And, one of the things is, we're at a point in time where I think a lot of rural hospitals we're still, our balance sheet is strong. We're not at risk of closure. I always want to make sure people know that, because there is that is a crisis occurring throughout our nation. So right now, 98, end of December, there were 98 rural hospitals that had closed since 2010. The scary part of that is at the end of October, that number was 127. So it's dramatically gone up in just about 10 to 11 months since over the calendar year 2019. So we've seen more closures occur, not in Iowa. Iowa's still been exempt from that. But we've had some in Minnesota, one in Wisconsin. Most of the closures are in the states to the south of us, Missouri, Alabama, a lot of them through Texas, Arkansas. But it is something about how do we evolve as a rural hospital. And I've spoken about that with others. And, we've got a rich history. As you said, Theresa, we've been open 98 years, and we're soon going to start celebrating our 100th as we look into that. And, you think back over those 100 years, we've evolved a lot. And those people who've been in our organization and those who led the health center throughout all those changes. And it's just about how we continue to evolve just like every place else, and adapt and use technology, or what services are sustainable and the right services to provide, or how do we adjust and maximize the services that will sustain us and keep us as an access point for the next 100 years.
Basically, that's what you do to address between talking to legislators and then evolving and adapting. That's how you hope to meet some of these challenges on a day-to-day basis to just the ordinary person out on the street. They hear EMS services non-essential, OB non-essential, and that scares people.
Right.
And I know there's been a lot of discussions, both with other counties, with our own county board of supervisors, about emergency medical services, the ambulance.
Right.
And what's going to happen with that, because we're coming up on a deadline in June of next year, 2020. That's kind of important. And I've been reading about, this is happening in Jefferson County, Washington County, Des Moines County, not so much the issue because of Great River Medical Center. I don't know what that does for them down there, but yeah, I know that it's affecting Henry County, Jefferson County, and Washington County. Yeah. And to some extent, maybe Lee County. I think they have, One private service down there. Okay. So what about Henry County?
Yeah. So it has been over the last few months. We have been talking about, possibility of regional ambulance services, or if we use the term EMS, emergency medical services, but that's what we refer to as ambulance, and over those last few months, we were talking about the possibility of regionalizing that with Henry in Jefferson County. Unfortunately, recently, it was determined that we couldn't make that happen within the next year. And so Jefferson County is going to be moving forward as they look at things, how they support their EMS services in Jefferson County. I do think it's a solid solution to regionalize that down the road. Why is it a concern? It's because of the funding and how do you find the men and women professionals to provide the outstanding critical 911 care, emergency care at the time. And so there was some recent statement in the local press about the future of Henry County Health Center's EMS services. And I just want to make sure everybody knows our number one priority is the safety and well-being of our constituents that live in Henry County. And so also, too, I want to make perfectly clear that Henry County Health Center will never cease delivering ambulance services without having another ambulance service or a transition point. I think that there was a statement that said that we would potentially stop at the end of June of 2020, and it's that we won't just stop and, oh my gosh, there's no ambulance service. We will, continue to provide the service, or we will continue to examine how do we transition services. And I think that's one thing I want to make sure everybody understands. And we know how important it is for our community. We know how important it is for our health center. I think it's an essential service, and when you talk about essential service, Theresa, I see it as essential as police and fire.
And that's the way residents of Henry County see it.
I believe
they don't understand. That's it. It's essential, police and fire.
It's what every community should have under the Iowa Code, and actually nationally as well. It's not just Iowa. It's not deemed an essential service because back in the days, 40 years ago almost now, 40 to 50 years ago, our funeral home directors were the ones who were the ambulance service. And
that was basically transport.
Yes.
That was it.
And so it's just as those years evolved, and then what happened is private agencies started. Henry County Health Center started in the early 80s, and some of the providing that service. And then there was enough funding, payment, everything to make it a possibility. And in the regulations were such that volunteers could do it and meet the requirements. And so just as everything else progresses over the years, more regulation, more training required, more equipment required. How do you keep all that upkeep up along with ratcheting down payment for services when you provide those to your community? And so we continue to examine how those, and that's why we advocate at the state level. And that's where we need to start, is continue to advocate at the state level about how we get it deemed an essential service in Iowa. But, the interesting thing, of the 118 hospitals in the state of Iowa, only 19% provide ambulance services. And Henry County Health Center is one of those. And so the other 81% do not. And the reason for that, especially for like the critical access hospitals, it's a not cost-based reimbursed service and under the Medicare program, so it draws down our payment financially for the rest of the organization. And so it's a sustainable service by itself, but because it's operated and owned by a critical access hospital, it draws down the payment for the overall organization. But we have great men and women that do just amazing things. We were, many years ago, we were recognized as the hot ambulance service of the nation. We continue to be recognized. We have leaders within our department who are speakers on statewide boards, et cetera. And so we do a lot of wonderful things. And so we are looking at how we can continue to keep that service locally, and how do we transition that potentially as a Henry County service locally. And we're going to continue to talk with the Henry County Board of Supervisors to see what the possibilities are of what a new potential structure could be. And we don't have anything definite at this time. And hopefully over the coming months, we will have that more defined on what direction we need to go. I will tell you though, but we're going to still have an ambulance service. So I do want to make sure everybody understands that. I know there was maybe some concern over the last week, but we do want to make sure that there's going to be an ambulance service in our community.
I think the situation with Jefferson County kind of confused things somewhat, because they have a contract with, is it basically a private company?
It is.
And that contract is coming due.
Right.
And Jefferson County would like to change. They are not happy right now with that contract. So they're under a specific deadline as far as end date for the contract. If they wish to renew it or not, that'll be up to them. But yeah, you have to explore all the options, have those discussions. And I know we've had that big in-depth discussion with the Board of Supervisors, and they're on board with the idea that, yes, it is important, just like law enforcement and fire.
Right. And I think it's one of those, you mentioned the Washington County, they're having the same discussion. They'll have to make some form of decision over the next 12 months as well. And there's other parts of the state of Iowa that have the same discussion going on right now. And so it's one of those,
again, we're not alone.
No, we're not alone. And so that's one of the things that's why I always tell people, but it impacts us most locally because that's all we know and all we see. And that at the state level, we're very aware of what's occurring throughout the rest of the state. And Des Moines County is a little bit different because actually majority of all their 911 services are provided by Burlington Fire. And so Great River Health System does have what's called Superior Ambulance, but that's for transports. It's not 911. And so Burlington Fire handles that. And so that's a little bit different because that's city, and you have your fire service, and some larger urban communities, their fire does offer and provide that, just like in metropolitan areas, they have that. So in the communities, it's usually either county hospitals, county service, private ambulances, or volunteers. And there's less volunteers in the smaller communities. So how do we make sure we have the resources? And one of the most important is the people.
All right. Basically to be continued.
Yeah. And so, I would say this is, and I've spoken about it at the health center, and this is, obviously a year that the health center, we're examining how we continue to evolve and how do we transition, and I do believe transition will be occurring at the health center. I do believe we need to. I think, as I stated, it's throughout those rich 98 years, think of all the things, how it's transitioned at the health center, from additions or change in services or what we've done. We became a critical access hospital. We're 25 beds, and so those are things that were courageous, and we did that. So we were still here. And that is our core mission. Our mission is to enhance the health of individuals in our communities through high quality, effective, and efficient services. And those last words are very important. And so how do we make sure we're providing high quality, effective, and efficient services? And so that's where the board is at, and that's where we're at in terms of an executive team about trying to make sure we have that for everyone in our community going forward.
All right. Robb Gardner is Chief Executive Officer for Henry County Health Center. Robb, thank you very much for joining us. And of course, if anybody ever has any questions, Robb's available, his staff available to talk with you. If you have any concerns, just go ahead and bring them to Robb.
Yep, please do. Always happen. I'm out. I think people know I'm very active in the community. I'm out and about. So always please feel free to stop me, or if you contact my office at the Health Center Administration, you can either reach me or Shelley Doak, our Public Information Office Director, and she'll be happy to help.
All right, Robb, thank you.
Thank you, Theresa.